Dr. Ennis, since you're doing a lots of, work injuries, dramas, and stuff like that, let's talk a little bit about, what should a person be worried about who starts having, tingling extremities, like in the toes, the legs, the fingers, starts having numbness, starts falling, his hand, leg falls asleep a little more often than like when he sleeps, maybe muscle weakness, quite often we're told everybody gets that, but could there be a systemic problem with it? Because sometimes just normal, those problems come and they're not very severe, but sometimes those type of problems I just mentioned, they really have a very basic fundamental systemic problem with their nerves. Can you shed some light on that and tell us a little bit what people should pay attention for and get checked for? Because we can check things today, but the problem is we don't check things, and we only check it when it really handicaps us one way or the other way, whatever that might be. And that's when we hear from the doctor, you came too late. Tell us something in that area so that we can avoid the you should have come a month, a year earlier type of thing.
Well, certainly numbness in the toes or the distal extremities. The most common cause of that is a peripheral neuropathy related to diabetes. So any physician in primary care sees quite a bit of that, and it's important if that occurs that you see a physician. Certainly, if you just have it for one day, it's not a problem. But if it goes on beyond 2 or 3 days, you should have it checked out. The reason that's important is because the hope is that if your diabetes is, if you have diabetes, if diabetes is the thing causing that, then having your diabetes treated and controlled will hopefully make that symptom less and will make the peripheral neuropathy less. And so if you have symptoms related to numbness or tingliness of the extremities, and particularly if that continues, that is something that should be managed by a physician. You should have a diagnosis, and then hopefully the proper treatment after the diagnosis is established. It can be many different things, but the most common thing is diabetes for them.
I see. Okay. And so that's kind of like at that point, the person doesn't know yet he has diabetes, or that's just really the onset basically of it, or it could be the onset of it. And it could happen to people who are not necessarily heavy overweight also, yes or no?
That's correct. It certainly is. You certainly can. Most of the time, peripheral neuropathy from diabetes is a late onset, and so usually doesn't happen at the beginning. But there are people that carry diabetes undiagnosed for a long time. So if you have tingliness or numbness of a foot or a toe, particularly if it's on both feet or both toes, you need to be evaluated.
Okay. All right. So basically go and get your evaluations done, because then something can maybe be prevented, or at least can be eliminated. Like, oh well, you just sleep bad, get a better different pillow, do things like that. So basically an elimination, there's nothing basic wrong with you, we're fine, or, there's something there, and you better start working on it. Because I've heard once the nerves get damaged too much, they literally reach a point of beyond repair. Is that true?
That's correct. That's why I mentioned that peripheral neuropathy is usually a late effect of diabetes and not an early effect of diabetes. But the earlier that a diagnosis is made, the more chances you have of reaching either a stalemate of the process or a resolution of the process.
Okay. All right. Well, again, very interesting. Thank you very much, Doctor.